So we are very excited about this data because now we are preparing with the competent authorities a phase III design. Having better results in younger patients, for instance, is quite important because immunosenescence is a phenomenon well described in cancer as well as infectious disease. For instance, we know that older patients are not so reactive to COVID vaccines because the cellular immunity is crippled in a sense. So it's the same in cancer. And the fact that we see much better results in younger patients less than 65 years old just indicate that indeed our targets are not expressed by tumor cells. So for sure, our targets are the CD8 T-cells, so the adaptive immune system. Now, in addition to that, we did show that, of course, we have more CD8 T-cells in the blood, circulating CD8 T-cells. And that's something you don't see, for instance, with most IO product like anti-PD-1. With anti-PD-1, you may see more CD8 T-cells at the tumor site. That's called a hot tumor, but you don't see an increase in the blood. So we have really activated, generalized activated immune system with more CD8 T-cells, but also more interferon gamma, because these CD8 T-cells are activated. And then we look whether there was a correlation between overall better OS and number of CD8 T-cells, and indeed there is a positive correlation between these two. And again, we obtained these results in a double-blind placebo-controlled setting, and therefore we do believe they are quite important and will help us a lot to design a better, more on-target phase III design. Just to remind you that this major population of metastatic breast cancer patients are there has been no innovation in the last 20 years for these patients starting chemotherapy. There is a lot of innovation, of course, before starting chemotherapy for patients receiving reinforced endocrine therapy with CDK4/6 inhibitors. But when after CDK4/6 inhibitor, when you start first-line chemotherapy, your life expectancy is pretty bad. So it's a high unmet medical need. And we think that with Eftilagimod as a systemic immunostimulant, we can achieve something here in terms of overall survival.